Hi, I'm Susan Sparks. I'm a health economist on the health financing policy team at the WHO headquarters in Geneva. I've collaborated with the Rebuild Initiative over a number of years on specific areas related to health financing policy and how it contributes to universal health coverage. I've been involved with the Rebuild Initiative over a number of years, specifically on the topic of the political economy of health financing reform to understand the political dynamics of those reform processes, as well as the strategies that have been used to manage those politics. So we worked with Rebuild looking at the political economy of health financing reforms in Indonesia, Thailand, and Nepal following crisis to understand who were the key actors involved in those reform processes, as well as what were the strategies that they used to advance reform and take advantage of key windows of opportunity. And similarly, we've worked with Rebuild in a set of countries to understand the politics of budget reform and what are some lessons that come out of those processes for other countries that are undergoing budget reform. In both cases, policymakers and practitioners in the focus countries and more broadly have been able to take the lessons that came out of these analyses to develop politically sensitive strategies that can advance health financing reform and UHC. Having been a part of the Future of Global Health Initiatives process, I found Rebuild's research on the global health architecture to be critically important as we all engaged with questions around the future of this architecture and needing to have concrete evidence as well as findings to base those discussions. And the team's work really brought together the technical as well as the political understanding into their analysis that helped inform a more realistic approach to the discussions around the future of the global health architecture. I find the Rebuild Initiative to be one of the few that straddles both the academic and operational sides of health systems reform. And having this dual perspective was particularly critical for us as we worked with Rebuild to develop the how-to guide on the political economy of health financing reform. The team really brought their deep expertise in health financing and systems reform with this practical and operational approach.